this time.
Hi everybody. So you are tuning in to such a wonderful video about midwifery care. So I'm Tiffany from Push Prenatal and Postpartum Counseling at the Nest in Addison. And here I have with me my neighbor, my next door office neighbor,
Cassia Walcott. So I'm the midwife here at the Nest at Singing Tree Midwifery, and my office here is right next door to Tiffany's. And so we're finally getting together today to talk a little bit about midwifery care and how that relates to mental health.
Yeah, so I have all the questions. So to be honest with you, before I kind of jumped into the birth world, I had all of these preconceived notions about what a midwife was, and I kind of just thought hospitals were my only option. And so today we're here to talk about not only midwifery, but what a home birth looks like and what the benefits are. So my first question for you is, what is a midwife?
Okay.
And then what do you do?
Okay, so a midwife, you know, the word midwife comes from German, which means with woman. And so a midwife is usually a woman, but it doesn't have to be, but a healthcare provider in the state of Texas. We have licensure for midwifery. So I'm a licensed midwife here in Texas, and we take care of women prenatally, attend their births, and do all of their postpartum care for both the mom and the baby through 6 weeks postpartum. So it's well women and well baby care. So we see low risk women, and we basically take the place of a more traditional healthcare provider for the childbearing year. So as long as you are low risk and you don't have complications, you don't need to see an obstetrician or another doctor for your pregnancy. You can see your midwife instead. So we're healthcare providers, but we're not general practitioners like a doctor. We don't treat other things outside of pregnancy.
Okay, that's really cool actually, because you know, for a long time I didn't think that you were like technically a healthcare provider, and I think there's a lot of misconceptions about the difference between a midwife and a doula. So can you tell me about that?
Sure. So doulas are amazing, and I love doulas, and what they do is completely different from midwifery. Doulas provide informative support, educational support, emotional support, and physical support during labor itself. So a doula is someone who is with you during your labor to help you navigate what's happening with your body, mind, and spirit as you go through that process, whether that be in a home birth, a birth center birth, or a hospital birth. In a hospital birth situation, they're even more essential because there are things that go on in a hospital where you have to sort of navigate choices about interventions and things like that. And so they know all the stuff and can help you understand the pros and cons and the risks and the benefits for choices, and can kind of help you navigate that. So doulas can work beautifully in partnership with midwives, but they're not healthcare providers. Okay. They're there as a support.
That's really great for you to distinguish, because I get a lot of questions about that too. Like, what are the differences between a doula and a midwife? So I think that's really great.
Yeah, I think a lot of people wonder that.
Yeah. So what are some of the advantages of home birth?
So that's a hard question to answer, because I really believe that different birth situations can be beautiful and lovely and perfect for different people. I'm not a midwife who like holds the banner for home birth and says this is what everyone should do. So what it is it's another option outside of sort of traditional health care for your pregnancy. And it can be a beautiful, wonderful option for many, many people, but it's not for everyone. So I did make these little paper things today to sort of I don't know if you can read that actually.
I'll hold them while you talk.
And is it going to be backwards, or will it show like?
I think we'll be okay.
Okay, so these are just the 4 pillars of midwifery, and it sort of helps to distinguish what the differences are between traditional healthcare for pregnancy and birth and midwifery. So the main pillars are continuity of care. So when you have a midwife, what that means is that usually you're seeing the same person throughout your whole pregnancy, birth, and postpartum. So it's a little different from a practice of OBs where you sort of rotate through, see a lot of different people, don't necessarily develop a close relationship with any of them, and you don't really know who you're going to get once you show up at the hospital for your birth. So you have this ability to really get to know the person who's going to be there for you during your birth and develop a sense of trust between each other and a sense of comfort.
Yeah, I really like
So
that.
that's the continuity of care. The second one, what is the second one?
Informed consent.
So informed consent is another pillar of midwifery care. And, you know, we'd like to think that there's informed consent in healthcare in general, but it looks different in different modes of practice. And one of the main things in midwifery care is that your body is your body and your health care is ultimately within your control. And so a midwife is there to make sure that you understand your choices, to talk with you about the benefits and risks of any choice that you have to make. And ultimately the decision is yours in almost every case. So, you know, having the ability to stop, not make a decision right now, ask some questions, talk about it, feel comfortable, and have that empowerment of being in control ultimately of your health care.
Yeah. And so the third one is, I missed one. Sorry, guys. Is shared decision making.
And so that kind of piggybacks along with informed consent in that there isn't that sort of hierarchical relationship between care provider and patient.
Okay.
We are partners, we work together. I'm here to help make sure that you're informed and comfortable with the information, but I also respect you as a woman, as an intelligent, informed, educated person. And so there isn't that hierarchy, and decisions that are made jointly.
Yeah.
Yeah.
All right. So appropriate risk assessment
And
referral.
then, yeah, so the last one, and a really important one, is that, again, in midwifery, we're seeing low-risk people. And so a super important part of our job is to continually assess your medical, your health, your state of being, and any risk factors that you have, and to manage them appropriately. So a lot of people worry that maybe home birth isn't safe because you don't have all those extra people ready in case of an emergency. But in midwifery care, we're assessing risk at every moment. We're watching you with 1,000 eyes, as they say. And if there are signs of anything that's outside normal, we appropriately risk out people as needed so that we're almost never in a situation where there's a medical emergency.
Okay. So that, I was actually curious about that because, you know, I know that there are a lot of people who do home births, but they are low risk, like you were saying. So, but then I've heard stories of people who are doing home births and then like they ended up at the hospital. So, but what does that look like? I mean, you're assessing that risk.
Yeah.
Then what do you do?
Right. So midwifery is all about empowerment and helping you to create the birth experience that you dream of course. But ultimately, I think we would all agree that the very most important thing is the safety of mother and baby.
Yeah.
And so above all else, you know, if there ever needs to be a choice made, we're going to err on the side of safety. And so, so yes, hospital transfers happen all the time, but they're almost never emergencies.
Okay.
You know, they're not extremely unusual. It's probably, you know, in your average midwifery practice, it's probably